Listen to this. Did you hear the pause in between? Hello, and welcome to Irene Talks. My name is Dr. Irene. Since I'll be your doctor for the moment, I have some strong recommendations for you. I recommend you like this video, you subscribe, and you share this video with your friends and your colleague. If you're watching me for the first time, you are welcome. If you're a returning viewer, you are also welcome. It sort of explains itself. You can understand it as the pressure of the blood. But you see, in the body, blood is always contained in the vessels or in the heart. So blood pressure is the force or the tension that the blood puts on the walls of those vessels. It is caused by the pumping of the heart. So now I think you can understand why it is called high blood pressure or hypertension or hypotension. So that's everything you need to know. You're done for the day. Okay, I'm just kidding. So if you have ever checked your blood pressure before, you know that you get two values. Typically a bigger value in the hundreds and a smaller one less than or a little above 100. They normally put the bigger value first and the smaller value after, something like this. The first value is called the systolic pressure. It shows the pressure in the arteries when the heart beats, so while it is squeezing and pumping out blood into the vessels. Listen to this. Did you hear the pause in between? If you did, let me know by leaving a comment below. That pause leads us to the meaning of the second value. The second value is called the diastolic pressure, and that is the pressure in the arteries when the heart muscle relaxes in between beats. When the values are increased, it means the heart is working a lot or the vessels are not as opened as they should be due to things like atherosclerosis or both. Firstly, it is important to measure your blood pressure several times when you are at rest so you can get accurate values. If you are at home and you measure your blood pressure by yourself, try to measure your blood pressure when you are relaxed. Having that in mind, the normal blood pressure is Diagnosing hypertension in a person involves more than just the values. Yes, the values are very important, but also the family history of the person is important. The lifestyle of the person is important. The age of the person is important. And if the person has other medical conditions, for example, if the person is diabetic or not. Depending on where you live, the value for diagnosing hypertension by your doctor may be different. In America, for example, you have hypertension if your blood pressure is greater than or equal to 130/80. While in Europe and some countries, you are hypertensive with a blood pressure that is greater than or equal to 140/90 when measured at a clinic. There is a gray area where your blood pressure is high but you are not hypertensive. If you fall into this category between normal and hypertension, it is important to make some urgent critical changes, like adding healthy diet and exercise to your lifestyle. High blood pressure is bad because over time, due to the increased pressure, there are damages done to the walls of the vessel, causing blood to gather there, forming a clot. Also, there are damages to the heart and kidney and other organs. The person is at risk of developing serious life-threatening conditions like stroke or heart attack. I advise everyone to include some sort of physical activity to their lifestyle. Exercise reduces blood pressure immediately. It is recommended that you exercise or engage in moderate to intense physical activity for at least 2 hours 30 minutes per week. You can do 30 minutes every day or however you want. Healthy diet is recommended by your doctor. That is cutting down on fatty food, reducing salt intake and things like that. Take your medications. Yes, some medications have side effects, but if you notice any side effects of any medication, talk to your doctor instead, and it might be replaced with something else. So that will be all for today. Bye!